There are several questions a woman has in her mind when she's planning a pregnancy. Dr. Manjeet Arora will have the answers to all of them as she tells you about practices to follow in pregnancy.
Immunization during pregnancy, they need 2 doses of tetanus toxoid. First dose can be given anywhere from 16 weeks to the 20th week, and second dose can be given at the interval of 4 to the 6th week. And when we maintain antenatal record, we make a note of any high risk factors, any special precautions we are to take during this pregnancy, whether they are put on some special medication, like whether they are on ecosprin or they are on low molecular weight heparin, or they have been needing a cervical stitch, whatever factor which comes to our mind, or whether she has previous difficult deliveries or previous cesarean section, what information is going to affect the outcome of this pregnancy, we make a note of it. The general recommended routine for examination is that during the first 7 months of pregnancy, a woman is seen every 4th week. After 28 weeks, a woman is examined every 2 weeks till 36 weeks, and 36 weeks onwards, a weekly examination is recommended till she goes in labor. But certain variations can be there in high risk cases of patient with diabetes or heart disease or other factors where they would require frequent visits. During each visit, a patient, besides taking history, establishing her gestational age, her blood pressure, weight and swelling anywhere over the body is checked. Clinical examination is done where we see whether the baby is growing at a optimal pace. We again look for the fetal heart sounds, and if there are any concerns, we order for routine investigations. Approximately 10 to 15 visits are recommended for a woman during a antenatal period, and besides her tetanus toxoid, dietary advice is given where we always tell them to take a balanced diet containing pulses, vegetables, fruits, proteins, milk and yogurt twice a day, avoid street foods and foods with preservatives, and take iron and calcium supplements and any other medication which has been prescribed. Equal emphasis is given to the monitoring of the baby also. The growth is charted, and during the later months of the pregnancy, a woman is advised to keep a kick count. Generally, we tell her to keep a kick count after 36 weeks of pregnancy, 1 hour after breakfast, 1 hour after lunch and 1 hour after dinner. If the baby moves 4 times in 1 hour and 12 times during the 12 hours period, it is considered adequate. But we caution them, if at any time they feel that the baby is not moving adequately, they should report to the doctor, and then doctor can check the well-being of the baby with the help of further non-stress test or with the help of ultrasound, biophysical profile, and can look for the liquor around the baby and blood flow to the baby. And one should also make a note of any hospitalization during pregnancy, any other treatment given to the woman, and we should also caution the woman that if there is any bleeding per vaginum, leaking, loss of fetal movements, pain in abdomen, headache or any unusual symptom, she should report to the hospital. And during the antenatal period also, it is a good time that we should talk to them about stem cell storage. These days people are hearing a lot about that stem cells can help in future if there are some problems which are undiagnosed after birth. Yes, it is a good option, one can explore, though it is expensive at the moment, but people can take their choice. Also, antenatal period is the time where we should talk to the women that these days we have the facilities of painless labor in which we can give epidural analgesia. Though the course of labor remains normal, the pain perception, because labor pain is considered the severest pain. So we have these options in the form of epidural, and patient can be given in detail what is done and how exactly it works out. Though epidural pain relief does not guarantee a normal delivery, but if it is heading for normal delivery, it is beneficial. Another thing which we always talk to the patient is about the mode of delivery. If we look at the national figures, about 30% of the women, they need delivery by cesarean section for whatever the reason, whether it is a maternal reason or it is a baby reason. So we have to these days tell the patient that 70% chances are there she can deliver vaginally, 30% there may be a chance that she may need a cesarean section. Even in vaginal delivery, sometimes they need assistance because problems can happen at the end when they are about to push, that they may need assistance in the form of a forceps delivery or with the help of a ventouse extraction. And finally, once the patient has delivered, it is a good idea to make a note of the outcome, whether everything went smooth and whether we need to take any precautions for the next pregnancy.
For more videos related to pregnancy and health, log on to onlymyhealth.com.